Dr. Sepideh Behroozan. Now, I'd like to say Sepideh has quite a track record as well, and one of the most poised person here to be the keynote speaker for this event. Now, she's a family physician at the Newcomer Health Clinic here, which is, of course, close to where we're having this session now. So if you walk across the hall, then you're right into her practice space. Now, she has a well-decorated career as a pediatrician coming from Iran, and she's an international medical graduate, so let me say that. But you know what's unique about Sepideh's journey? She's also a medical graduate of Canada. And I think she can tell you about that program, of course, how she gained those two titles. She did not redo medicine, okay? But she's a medical graduate of Iran and of Canada. Now, she has quite a bit of experience working with Refugee-IEHPs, also supporting other Refugee-IEHPs and IEHPs as a whole coming into Canada, providing guidance and support to those individuals, and herself as well. She has quite a bit of lived experience. So yesterday I was told, just name the program here. Sepideh has gone through that program. Okay, so as a program participant, and she's also here to share that knowledge with you. Please, without further ado, help me welcome our keynote speaker, Sepideh Behroozan, as she comes to address you.
I don't want it to be about me or what I did, because over the past few years, I have learned that many people are heroes that I look up to them, and no one knows about them, how they struggle, either became successful or not. So I have prepared a few things through facts to say, and then later, if you are interested, I'm happy to say how I became IMG and CMG and all of those. So first, the warm-up. Raise your hand if you are not born in Canada, please. And online, please send something, some notes, something. I believe you can say like.
You can use the raise hand feature as well.
Okay, raise hand, please. Thanks for that. So I believe I don't see the numbers right online, but I can see in the room.
Okay, so we have 88 persons online.
Okay, perfect.
There are quite a bit of hands going up as well.
Okay. Now, if you speak more than one language, please raise your hand. And online. And I don't know the numbers there. If you speak more than 2 languages, please raise your hand. Thanks. And thanks. So in less than 1 minute, we realize that we are global, we are multilingual, and we have diversity in Canada. So we are not looking to diversity in future. We are diverse now. And we want to know why healthcare system does not recognize that or address that. That we really, really have a pool of talented, I believe, people who are ready to offer their skills to Canada. Don't get me wrong, I'm against the fact that newcomers come in and start working. IHPs come in and, okay, you can go in this hospital and work, because it's a huge change, and definitely people need to learn about the system, be really not checked, but assessed, getting the chance to learn about this new system. But even if they do that, the rate of success is very low. Now, it's interesting. For this talk, I realized that 260,000 IEHPs are now living in Canada. This was based on 2 years ago stats, and I'm sure now it's worse, because in some of the countries like mine, I'm from Iran, now there's a huge flood of IEHPs coming out. So it's important to know that many of these people, especially the ones who are coming as refugees, they have delivered babies under candle-lighting refugee camps. They have triaged blast injuries. They have run vaccination drives in remote villages, and they arrive with clinical mastery, multilingual comfort, and resilience, which many of us can only imagine. So these are not trainees. These are change makers, and they are on standby. There's a disconnect because if we now know that we have 260,000 IEHPs in this country, it's really heartbreaking to know that only 58% of them will work in healthcare system, in healthcare sector. And among those, there's a 41% of IMGs, 42% of nurses. If they are hired, they are working in the job that they were trained for. And meanwhile, we have 6.5 million Canadians without a primary care provider, either family physician or nurse practitioner, or any kind of primary provider. 6.5 million is a city, a large city. And I work only with refugees. So I work as a family doctor in Newcomer Health Clinic. We provide services to refugees. I see people who come from really areas that no one can imagine surviving there. They are telling me that, is this what we see in Canada? No doctor? What are you talking about? 1 year waiting to see the specialist, or 2 years to have an ultrasound? What are you talking about? So we are importing the talent here. We are exporting the hope. And in the middle, patients are waiting. Now, I thought a lot about what are the barriers, because the barriers, there are lots of barriers, but we can blame more easily the systemic barriers. And the first thing that I realized when I arrived was that I was lost. I had ISANS, luckily, but I was told apply to, at that time, PCRC. And I was saying, what is applying now? I went to the website and they said, print this cover letter with each of the documents. Just realizing what is the cover letter, how to have it there, not to staple it, and how to send it. It's really, really something that needs help and support, which in Nova Scotia we are lucky to have. And I'm sure in many provinces you have fantastic services. But the problem is that the licensure rule shifts from one province to the other province. So it's like having incompatible phone charger, or the power that you go from here to Europe. It doesn't work. And in all the provinces in Canada, unfortunately, we have that problem. Immigration policies wave people in, then the regulatory bodies keep them back, send them to the end of the queue. So the immigration says, yes, come in. Regulatory bodies says, no, sorry, not yet. And I did not realize this when I came in. So I was thinking that, okay, I passed the exams. At that time, EE, Q1, Q2, all the exams. I have the licensure of Canada. What can I do now? Nothing. Because I didn't know that this licensure is a paper. Working is something different, regulatory body, and that's based on the provincial, on a provincial level. So it's very confusing for any of us who comes here and wants to really solve this mystery of how to apply. But I don't want you to be all disappointed or hopeless, because there are also good news. There are models of success, but unfortunately in silo. I have always been in Nova Scotia since 2008, so I have no clue about other provinces. But I know that in Nova Scotia, ISANS, which is our main settlement services, pairs newcomers with mentors. They decode paperwork. They offer cultural navigation. And basically, they become our family, mentor, teacher, everything. There are practice-ready programs in Nova Scotia, and I'm sure in other provinces. And they are working to fast-track the physicians to rural communities, and they are desperate in desperate need for them. There are grassroots peer mentor circles, often run on coffee and goodwill, and they have helped hundreds of IEHPs. And I believe, knowing Neil for Pegasus, he is one of those people who, as a role model, has done that. So the programs work, but the problem is that these programs are not universal. It's silo, one here, one in other, one there, and they are all not aware of the other one's existence. So now, I don't want to be negative. So what can we do? I believe we can have a few things. One, if in a dream world, we can have harmonized credential recognition, a single transparent national standard that applies to everyone. So if we come to Canada, we go to somewhere, it says everywhere in Canada. Even realizing where is Saskatchewan, where is Halifax is difficult. Not for us. If I go to Toronto and I'm in a taxi, they ask me, where are you from? And I will say, I'm coming from Halifax. Halifax, there it is. And they are Canadian. Many people do not know what exists east of Montreal, unfortunately. And for the ones who are online, Halifax is very beautiful. So please don't. I'm biased about Halifax. So the second thing that I can think about is investing in integration pathways. The way that they invest in hospital beds, we invest in starting this clinic, we invest in funding hospital beds for this area. So I believe it's great if we can fund bridging seats, supervision stipends, language coaching, mentorship networks. So those are the things that would help. The other thing, third one, is that we have mountain of data. I believe there are so many projects and research done on IEHPs. We have lots of data, and we are continuing on doing the research. But maybe it's good to start implementing those and to move from pilot projects to policies. And the last one, the most important one, I believe, is having IEHPs at the table when they are making decisions, and not just having them on the waiting bench to tell them what's going on and what we decided for you. That's the way that here health care is provided, patient-centered care. So when we say patient-centered care, means patient is not sitting at the corner of the room and we decide this is better for you, this is your prescription, buy. We say, what's your opinion? What do you think? What do you want? So probably that approach would be helpful if the people who are going to be affected are also decision makers. Last night we had a session here, and I mentioned in Nova Scotia we had a fantastic multi-stakeholder group for years. All the decision makers were sitting around the table, from college, university, Doctors Nova Scotia, IRCC, NCC, all the representatives plus IRMHC. And that multi-stakeholder group really was successful. And for the 10 years that I was attending it, because I was taking time off from school residency to attend that one, we made lots of changes. But unfortunately, the fund was gone and it stopped with no notice. So I just want to remind that IEHPs are not waiting to be trained. They are waiting to be trusted. And it's not about charity. It's about smart, inclusive policy for a healthier Canada. So I prefer not to call them foreign trained. Maybe it's better to say future ready. And at the end, another show of hands, online please too. Who is ready to turn today's discussion into tomorrow action, doing something? Thank you so much. And online, thank you.